Health disparities are defined as preventable health problems that disproportionately target socially disadvantaged populations. What's left out is that these populations are often defined by factors such as race or ethnicity, gender, education or income, or even zip code. Health disparities are a serious problem, and according to the CDC, they can lead to increased healthcare costs due to higher rates of preventable chronic diseases among these disadvantaged populations. Some stats that really put these gaps into perspective, especially due to its recency, was that 19% of Hispanic people were more than twice as likely as their white counterparts to be uninsured as of 2021. And, at birth, Black people had a shorter life expectancy of 70.8 years compared to white people at 76.4 years as of 2021, which really put into perspective the importance of a healthy daily environment. In the 1980s, these findings began to appear, like through the Harvard Medical Practice Study, which found that insufficient healthcare was linked to poor and minority patients. Shortly after this, the U.S. government released the report of the Secretary's Task Force on Black and Minority Health to raise awareness of minority healthcare. By the late 1990s, advocacy groups launched initiatives for equal health care. Reports like the Institute of Medicine's Confronting Racial and Ethnic Disparities in Healthcare report provided recommendations for interventions such as raising awareness about harmful toxin exposure. Today, we strive to bridge technology and media outreach to health disparities by raising awareness and trying to get equal systematic healthcare changes. Some major causes of health disparities are a lack of education, employment, income, housing, and healthy food and exercise accessibility, or even a marginalized zip code, have been shown to significantly damage health. Insufficiencies in the mentioned areas above force people to confront structural barriers within healthcare systems. Toxin exposure and even unhealthy life choices, set historically through systematic and institutional oppression. This results in an unequal distribution of health resources that then perpetuates this health disparity problem.
Now, health disparities have a wide range of health consequences for individuals, communities, and society as a whole. To start, health disparities lead directly to poor health, as affected populations often experience higher rates of chronic disease, mental health disorders, and higher mortality rates. Additionally, there's a heavy economic burden on those facing health disparities. Health already costs more for impacted individuals, but there are other burdens on employment opportunities and productivity as well, which perpetuates cycles of poverty and health inequity. Health disparities also highlight the social and structural inequities that reflect broader issues of injustice and discrimination. This leads to social tension and faltering trust in systems meant to protect and promote health. Lastly, health disparities strain public health systems and complicate efforts to manage public health effectively. Populations with unmet health needs are more susceptible to outbreaks of preventable diseases, creating challenges for health systems trying to allocate resources efficiently. However, health disparities are not an unknown issue. One active initiative that's addressing health disparities is the U.S. Department of Health and Human Services U.S. Playbook to address social determinants of health. This is the first comprehensive government-led approach in the U.S. to fight non-medical factors that impact health, and a call to action to address health-related social needs, an initiative to improve the coordination and integration of healthcare, public health, and social needs will meet the complex needs of communities facing significant health disparities. Some of the successful strategies that have been used include expanding data gathering and collection to improve data collection, interoperability, and analytics capabilities to better understand and address social determinants of health. In addition, leveraging partnerships across different sectors and focusing specifically on actionable strategies carried out by organizations that can implement them is an effective way that the U.S. Department of Health and Human Services has bolstered backbone organizations against health disparities. By watching this video, you've already taken the first step to contributing to positive change, and that is knowledge. Self-learning and interest in justice are the key to facing the health disparities in our society today. The next step is getting your community engaged, whether it be your friend groups, your extended family, your teachers. The more, the merrier. Additionally, participating in or even organizing your own campaigns to support health equity policies makes a big impact when people can come together. Thank you for watching.